Floor. I do have a comment, a sort of, overall comment relating to your talk, which is most of the times we do believe that human rights concerning sexual health and sexuality means only transgenders, homosexuals, gay, lesbians, and so and so and so. But as we understood from Luca, Rossella, Mario this morning, everyone among the speakers, still probably cancer patients, chronic disorders patients, and so and so and so, do not have rights yet to be sexually active and sexually healthy. Is that correct?
I think the sexual rights, the human rights framework applies differently on different kinds of people, because on one side, as you said, the LGBT communities and individuals suffer from discrimination and less difficulties of recognition for adopting children if they want to have children. And there are very important controversies about the possibility of infertility, the so-called infertility treatment for non-heterosexual people, the marriage, as we said. So these are, the question are this group accessible to equality as everybody? But on the other side, we know also that the sexual revolution of the 60s was mostly a heterosexual revolution, which means the possibility to have sex outside marriage, the possibility to control fertility, which are rights for people who have sex with and for whom sex, procreation is a possible consequence of sexual activity. So this, and we perceive that still in many countries, when a woman has a child, is pregnant, when she is not married, it can be still a problem. There is also an issue that I did not discuss here, is the issue of the intellectual deficiency, the mentally retarded people. In French, we say les handicapés mentaux, which means the right of those people to have sex, because they legally, in France at least, they are treated like like children. They have no citizen rights. And if someone has sex, for example, with a mental retarded adult, he can be jailed for rape, because the person is supposed not to be able to give consent. So one of the possibility to treat, which is offered, is sexual assistance. But it's not for the mentally retarded. It's the people with physical and physiological deficiency and sensorial deficiency. But what in most of the mentalities, the sexuality of the mentally retarded is considered as excessive and needs to be controlled instead of being educated and and this is one of the issues of the sexual rights, the rights of the people in mental hospital with mental illness or mental retardation, as we said in the 60s.
Thank you very much. One question.
Yeah.
Two questions.
Thank you for this comment on the handicapped people, because I think this is a minority where the sexual rights are not really fought for, especially the mentally retarded people. We are doing a study now among hospitalized and mentally retarded people in the different homes, and their sexual behavior, their sexual needs. And it turns out that it is a very unresearched and under one little question. Do you have, you were mentioning this issue of people who come for counseling because they feel they would like to be both sexes, both gender. Yeah. I have two young men who do not want to have any surgery, but they would like to have female hormones. There is no guidance about this issue. Does anybody here have experience with this group of people who come? They do not want to have genital surgery, but they feel that they would like to feel more their female side, or whatever you call it.
You know, in the official process of transgenitalization, as they say in Brazil, the hormone treatment, the hormonization is the first part of the treatment, is the first step of the treatment. And then, after some time, surgery will come. But some people, they just don't, I mean, we need to have a different view of the gender binary. We need to come out from the idea that there are only two sexes and two genders. And we should read Anne Foster-Sterling, which speaks about 5 sexes, you know, which is not only genders, but biological and physiological sex, which are not only binary. And you know those issues with the people who come to birth with genital ambiguities, and the doctor doesn't know what to do. Do we need to give one sex or the other at birth, or do we need to wait the person to choose what sex they want to have? And this is a very important ethical and difficult, because you know when the gynecologists go to see a woman who just gave birth, they want to know, is it a boy? Is it a boy? Yes, no, and you cannot even say that it is a girl, you know, which is a bad news. And there is a worse news than to have a girl, is we don't know what it is. and the physicians are very stressed and have very difficulties to be able to announce to a family that they don't know the sex of the child.
Thank you. Jim, can you keep your question later on? We do have a time slot.
Yeah, no. I know. So with any right comes a responsibility, and I think it's going to be imperative for sexual information and sexual education to accompany sexual rights. I think when we get sex ed years after people start having sex as young individuals, it's come too late. And we need to understand gender, sex, sexual behavior, sexual pleasure, sexual rights when kids are young, not after they've all started having sex and begun to ingrain themselves in cultural stereotypes which have nothing to do with sexual realities. So I think if we can empower countries and states to start to decrease the age at which kids get sexually relevant information, we're going to be doing a great service. And as an example, very quickly, one state in the United States right now is trying to prosecute a 13-year-old boy for quote-unquote self-rape because his mother caught him masturbating, and his mother had a problem with that. This is a travesty if an intervention cannot be done to give information, real information, to people. And I think sexual rights are great. It's wonderful that the World Health Organization is behind this. It's wonderful you can get 200 countries together on wording. But the practical implications are we've got to have education, and that's a responsibility of those countries when they sign on to this.
We agree.